Let's start with the intracavernosal injections, okay, or ICIs if we refer to those, okay? Again, this is a medication that's a little bit more invasive. This is a medication that requires you to inject yourself directly into your penis prior to sexual activity. What's great about this medication is that it is very effective. It's pretty much the closest thing we can offer as to the G word, guarantee. Okay, it's about 90-ish% effective, whereas the oral medications maybe closer to that 65%. So the ICIs are the closest thing we can kind of make sure, okay, let's try this, let's see how things go. That same conversation where I talk about those ICIs is where I discuss our Limitless Pulse and our LimitlessResurrect procedures. Because what those are doing, those are actually going to help kind of find the root cause or help aid in fixing the root cause of the erectile dysfunction, which at the end of the day, blood flow, okay? We're trying to promote more blood flow and healing, and those procedures allow us to do that. So typically the way we set up our pulse procedure, we typically set that up with one procedure of that per week for 6 weeks. That is then followed by a PRP injection in the first month after their last pulse treatment. That's typically how we set up things. The pulse and the PRP have documented good results by themselves. We've just seen it more that we've seen better results when we combine the two. So for us, it can typically consist of 6 of those pulse procedures, 1 time per week for 6 weeks, and then it's followed up by 4 PRP procedures, but those procedures are spaced out every 10 to 12 weeks. Everybody has varying degrees of erectile dysfunction, okay, or varying degrees of damage in terms of, whether they are diabetic, whether they've been, they've had high cholesterol. We can get plaque buildup, scar tissue buildup, just as we do in any other vessels of our body, we can get those the same in our penis. So our job is to try to kind of heal that and kind of help just restore blood flow. Everybody's different when it comes to results. It's all about reaching that threshold where we see in terms of that benefit in terms of improving blood flow. Some guys, it's after a couple wave procedures. Some guys, they may not see it until after their first PRP or second PRP. It all depends on the guy. But overall, especially with the PRP, 90% of guys will see some improvement. When I say some improvement, mind you, it's a varying degrees there, but I always tell guys, I'm not gonna give you the erection you had when you were 20 years old. But our goal is to hopefully, hey, we can improve maybe some spontaneous erections. Maybe we can start, maybe we don't have to use as much of a medication that we were using prior to get you to the same, or have any medication work. Because there's plenty of guys who come in where they've tried absolutely everything and they're still not getting the erection that they desire. So this helps us kind of help it treat that root cause. That way we can use medications more efficiently to get that quality erection that they're looking for. So if I do a pulse and PRP and we're taking months to really help with those spontaneous erections, and maybe you're not taking it or orals don't work for you, well, that's not doing us a ton of good, because I still want you to try to improve some blood flow while we're in the midst of these procedures to help not only get the most out of the procedures, but that you can utilize those erections. That's why I always talk about if guys are not responding to oral medications, that we use the intracavernosal injection therapy in the midst of our procedures that we're doing. Or let's say you're getting a little bit of benefit from oral medication. Let's continue to do orals over there, because at the same time, that's promoting blood flow as well. And that's all what we're trying to kind of enhance throughout the entire time: blood flow, healing, revascularization of that tissue. So those can aid, although we're not maybe getting you the best direction you want sometimes, whether it be oral or the ICIs, but they kind of all work together in terms of making sure that at the end of our treatments, we're going to see some benefit for you and when it comes to sexual health.